Pediatric dose calculations. Part 2. So the next example is intramuscular to intravenous route dose calculation. Let us take an example of diclofenac, which is 0.5 to 1 mg per kilogram per dose, given 3 times in a day. The common presentation of diclofenac is 75 mg in 3 milliliters. Let us take an example of a 6-year-old boy weighing 20 kg. Step 1 is to find out the total dose. Total dose is calculated by weight of the patient in kilograms multiplied by total dose of the drug, which is equal to 20 kilograms into 1 milligram equals 20 milligrams. Step 2 is ml to be administered. The formula is total medication dose divided by milligram of presentation into milliliter of presentation, which is equal to 20 milligrams divided by 75 milligrams into 3 milliliters, which is equal to 0.26 into 3 milliliters, which is equal to 0.78 milliliters to 0.8 milliliters given TID. Next example is drug calculation with reconstitution. Let us take an example of benzothine penicillin, 50,000 units in a single dose. So it is enough to calculate the single dose. Example, child weight is 14 kilograms. Step 1, total dose is equal to 14 kilograms into 50,000 units, which is equal to 7 lakh units given intramuscular. As it is in powder form, it needs to be reconstituted. So the presentation of penicillin is usually 1.2 to 2.4 million units with 5 milliliters of sterile water. The step 2 is drug concentration, which is equal to presentation of the drug divided by amount of milliliters for reconstitution, which is equal to 12 lakh units divided by 5 milliliters, which is equal to 2,40,000 units, which is there in each milliliter. Step 3 is ml to be administered, which is total dose obtained divided by drug concentration, which is equal to 7 lakh units divided by 2,40,000 per milliliter, which is equal to 2.9 milliliters. Here are a few examples of the medication dose and the presentation of the drug. Paracetamol is presented in syrup form as 120 milligrams in each 5 milliliters, whereas the dose is given as 10 to 15 milligrams per kilogram per day in every 4 to 6 hours. Amikacin, dose is 15 milligrams per kilogram per day every 12 to 24 hours. In presentation form, 250 milligrams is there in 1 milliliter, or 500 milligrams is there in 2 milliliters. Amoxicillin is 80 milligrams per kilogram per day, divided in 8 to 12 hours. In syrup form, 250 milligrams is there in 5 milliliters, or 125 milligrams is there in 5 milliliters. 2 forms of presentation are available. Ceftriaxone is 50 to 100 milligrams per kilogram per day, divided every 12 to 24 hours. In the presentation form, it is 1 gram of the drug. Prednisolone, 1.2 milligrams per kilogram per day, divided dose into 12 to 24 hours. In presentation form, 15 milligrams is there in 5 milliliters. Clarithromycin, 15 milligrams per kilogram per day, divided every 12 hours, which is 250 milligrams is there in 5 milliliters, or 125 milligrams is there in 1 milliliter. Gentamicin, 5 to 7.5 milligrams per kilogram per day, divided dose, 12 to 24 hours. In presentation form, each 2 milliliters has 80 milligrams of drug, or each 2 milliliters is also having 160 milligrams of the drug.